significantly impact daily life, limiting mobility and reducing quality. Whether it's pain or numbness in the leg, even if there's irritation in the leg, I can still walk. When I try to go, I can't even pick up my shoe with my leg on the ground. I don't know what's happening, but now I have leg pain along with hip pain. Numbness in the leg, irritation, and all of this is related to our back pain. Let's take that as an example. Is sciatica a precise term? If we talk about it, we can take sciatica as an example. On a global scale or even in our country, how widespread is it in our country? To what extent is it causing us problems? It's unavoidable in life, posing a huge threat. Medicine addresses this. You can't go on without experiencing it. It's such a huge threat. There is a medical field that addresses this. Even after trying many various treatments, doctor, I still haven't seen any relief from my hip pain. I've just been managing that pain as usual. Can't just work. For this, let's simply wrap it up. This video is about back pain, leg pain, numbness, and irritation, such as when walking, having no sensation in the leg is a 100% issue related to this problem. This video is aimed at providing a comprehensive solution to you all. I'm saying we can present this. That is, if we take it on a global level, more than 100 million people, that is over 10 crores of people. It's affecting me. This back problem has been ongoing. If you look at the main issue in the back, it's disc prolapse. I have issues with my L4 and L5 in my back. The doctor says I have problems with L5 and S1. There are issues at the neck level. There's numbness in the leg and hip. Along with the pain, there's also numbness in the leg. It's like this. It's definitely a disc problem. There's a lot of it in this blue chart. Have you seen this is about 100 million people? The most affected problem is this. And next, the problem is spinal canal stenosis, which is the narrowing of the pathway in the spinal column. The third problem, if you see, is bone displacement, similar to joint dislocation. Bones can shift in the human body, but it doesn't happen that rapidly. Joint dislocation is very common. Why does this joint dislocate so often? Why does this joint dislocate? What is the nature of the joint? Why does it happen so often? What should we do to fix it without it dislocating? How can we prevent it? If it comes, how can we solve it? That's the issue with nerve sciatica. We're saying everything is coming, but what can we do to prevent it from coming? How do we fix that? If you look at it, this is the main thing. If you look at what causes back pain, all those back problems are due to, it's because of bending over and standing for long periods while working. The Indian population, we are an agricultural nation. Our laborers do heavy work. If you look at it, whether it's farming or not, we are an agriculture country. Plus, our manual laborers are doing heavy work while bending down. If you look at the mothers who lift weights, they are often bending down at home, bending down to clean or sitting down to work. Whatever they're doing, they keep bending their backs again and again while working. The reason they have so many activities is because of that back. The joints in between keep bending, and then they get straightened out. What happens is that friction occurs, leading to some damage. We talk about wear and tear, and that's how it gets displaced. If you look at it, if you take 100% of the people in this, the MRI, I have a problem with L4 and L5. There's an issue with L5 and S1. It's there, but that kind of problem shows up in the MRI. One problem we often have is sciatica. There's no need to be afraid that it will happen. When you ask why, if you take 100 people, it ranges from 1% to 3%. It's really only the people who get disturbed. You can have back pain, leg numbness, feel leg tightness, numbness, tingling, and a burning sensation without any feeling. When you're walking, if your shoes come off, problems like this only occur in about 1% to 3% of cases. In this, if you look closely, it's mostly men who are affected. Why is that? When you ask why, we're talking about manual workers. Those who are doing bending activities are the ones who are affected the most. We need a proper understanding of this. If we're going to explain this, it's about exercise. Why do you want to ask? This is our detailed explanation. Emphasize exercise. Avoid exercising with back joint pain. When can I exercise, doctor? I have a lot of back pain. If that's the case, should we exercise? Definitely, we shouldn't do that with the back joints. If you ask whether we can do any exercise, the answer is no. We're talking about the strength of the muscles in the back. To what extent is the back joint? It's shifted. What should we do to keep it from shifting further? Earlier, what is there in that joint? What is that joint made for? Like, what content is there? How far is it shifting? What stage is it going to? When we talk about it being affected, we definitely need to know about this joint. We need to understand why the spine, if you look at it, we do exercises in the gym, we bend down, we stand up, we do everything. There should be bone movement between those bones, but it should not be stationary. There should be movement. The bones shouldn't get damaged for that reason. It's like working with a suspension. That's what the intervertebral disc is. There's one thing, this intervertebral disc, if you look at it, there's a gel-like content. It's like a suspension. It should be inside. If we let it go, it will become old. It should indeed come to that state to cover this, the gel. What is the cover for? To keep it from getting damaged outside. There's something called the annulus fibrosus, which is like a wall or a barrier. The annulus fibrosus is there. There's an outer layer, and inside it, there's the gel-like nucleus pulposus. This gel is crucial for suspension. It attaches to the bones, sticking them together. That gel is what's important for the suspension, to keep it from being pushed out. To keep it in place, we attach it to the bones, sticking one bone to another to maintain a strong hold and to keep the gel from being pushed out. There's the annulus fibrosus. Why am I saying this is important? Because of this bending. In activities, if you look at this annulus fibrosus, if it tears, the gel will definitely move out. This is what happens with the spinal disc. The problem is lumbar disc prolapse. The first reason for this is happening here. The first problem is that the annulus fibrosus tears. That tearing happens. There are certainly stages to it, and there's treatment for those stages. This annulus fibrosus and nucleus pulposus, both of these are very, what's important is to strengthen this. What we need to do is we need to follow the correct proper techniques. What are those techniques that we need to follow? How do we bend without putting too much pressure? How can we avoid that? I'm going to explain about that. Why does this joint dislocation happen to us? Now, if there's a hip problem, pain will come in the hip. Why is that? If you say there's pain in the leg, it happens when the hip joint dislocates. Later, there will be a spinal column in the structure. There are 33 vertebrae, and in between them, there are joints, and when these joints move, they move forward and backward. When it moves, it's the back that gets affected. This is the weak area of the spine disc. If you look at it, the weak area is on the side. Let's say the posterior lateral area, which is at the back. This is the weak area. When it dislocates in this weak area, what happens? This nerve is located at the back of the spine, coming out from the right side. Nerves that can go to the left side of the legs come from there, that's all. The sciatic nerve is formed when this joint dislocates. It compresses the sciatic nerve, which in turn affects the hip and leg. Basically, at the back of the leg is literally the sciatic nerve. It's like a shooting pain, like an electric shock pulling at the nerve. It feels like a pull, like a grip, or like a lightning strike. Sometimes a pain like that can come and it can be a bit slow. It can feel like a cramp at night when you're trying to sleep, pulling on the leg. When it gets really intense, the leg might go numb. Why is this problem happening? See the first activities. Bending if you see activities, crouch down and stand up. Lifting too much weight, especially when you're bending your back while working, can lead to problems. Lifting weights worsens it. For some, it's genetic. There is too much third genetics for some people. Do you want me to say it or not, Mom? We're both overweight, doctor. I'm also overweight. It's there in the body, even if you control your food and exercise. Even if you try, you can't reduce it due to genetics. Obesity comes from that, and then we eat normally. Methodically taking any physical activities with us. Sedentary lifestyle is common. I try to eat well. There's no time to exercise. I don't have control over my food. I can't control it, not just me. I try to follow my food correctly on my own. All religions are fit. I'm the only one like that. That's how it is, this kind of sedentary lifestyle. It's about food habits and physical activities. When there's a lack of these, it leads to body weight issues. Sometimes family history causes obesity. Genetic obesity occurs. Weight gain pressures the body. Genetic obesity is what often contributes to body weight issues. When the weight increases, the load also increases. At that time, these discs are under pressure. When it increases, the pressure also increases. In this, there's another shocking aspect. If you look at the issues, even diabetes can affect this disc. The elasticity of that jelly refers to the elasticity of the disc, which means it's like that jelly. It loses its properties and becomes slightly dry. So because of that, the suspension goes and it quickly leads to a disc prolapse. Diabetes is also a reason for this body weight issue. Diabetes can affect the back. Our activities contribute to this. Take care of it. It increases the disc problem. No matter what we do, this is the case. Our activities are a significant reason for this. You need to take care of it well. Even if you're fit, if you ask whether disc problems can occur, the answer is definitely yes. There are chances for problems to arise. If you look at it, it's improper. When we lift a weight, there's an improper technique. Bend down and lift a weight. Lift the bucket and place it there. I thought about getting a massage for 2 or 3 days. Apply the ointment and take some rest. Let's see if it gets better, doctor. Went to see the doctor, arrived, he checked and said it was like this. There could be a disc prolapse. They said to get an X-ray and MRI. They told me to get an MRI, and when I looked at it, there was a problem at L4 and L5. If you ask what the main reason is, it's the improper technique of weightlifting. Lifting, if you look at it now, is normal. Look, this disc in the back is under pressure. It's experiencing stress. Did you see? It's lying normally. When there's a 25 kilo of pressure at that spot, it's on both those joints and bones. Disc 100 kilo, 200 kilo, 300 kilo. When it is 100 kilo and standing down 200 pure to bow down, even when bending down, it can go up to 300 kilo. What's surprising about this is, if you look at it, we think that when we bend down and lift a weight, lifting is where the problem worsens. If you sit and lift, it's not as much. We think, no, it's not like that. Stand still, bend down and lift. When it is approximately 200 kilos, sit down and bend down. When lifting, it can go up to 300 kilo. The reason I'm stressing this is, in this sedentary lifestyle, we do a lot of software work in the office. We'll be working while sitting. Suddenly, something falls down. If it falls down, when we bend down to pick it up, we should be very careful. You shouldn't take an abnormal angle. Keep your spine straight. Lift it. Sit straight. We've put up many videos on this. You should avoid bending your back as much as possible when sitting. That's what we want. Videos will be uploaded. You can sit straight or you can lean back a bit while sitting, like that. Ergonomics is key. Computer height matters. Pressure changes when bending down. You need to have the computer at the right level. The height of the computer should be appropriate. When you're bending down, what happens to the pressure when you bend down? When sitting and bending down, it can go up to 300 kilo. When you're almost lying down, it can be around 25 kilo. When sitting and bending down, the pressure can increase almost 10 times compared to that. The pressure increases 10 times the pressure. When the pressure increases like that, definitely the pressure inside increases, and there's a chance for the discs to slip. As we have previously mentioned, when you sit and bend down immediately, lift it while keeping your back straight. Sit down and lift it. When you're sitting and lifting, keep your back straight while bending down. Don't bend your back too much when lifting. This is really important for us. What's the issue with having too much weight? Even just looking at that bending pose, a sedentary lifestyle often leads to obesity and excessive body weight. Simple work can lead to problems. Issues arise, so we need proper lifting techniques. Even a very simple task like this can often lead to problems. Also, proper techniques. We also follow lifting techniques. If we do this, we will definitely find a solution to hip pain. If we find a solution to hip pain, it will automatically help with sciatica as well. What kind of symptoms do people experience to get relief like this? If you look at it, is it just hip pain that you're experiencing? Ask. We have a lot of videos on sciatica along with hip pain. We've posted videos about this regarding the displacement of the discs. There's a gel-like substance that I mentioned, which is the annulus fibrosus. There are small tears in the annulus fibrosus due to body weight. Whether you're bending down too much or standing up straight when you're lifting, if you sit and bend down like this, we'll follow improper techniques from time to time. If you do this, problems like this can arise. Sometimes it can be genetic. For some people, having too much weight can lead to issues. If there's too much weight, there can be slight tearing and the disc might bulge a little. We call this a disc bulge. Why are we discussing this in detail? What I'm saying is many people send their MRI reports, and in those reports, stage 1 and bulging disc issues improve with simple treatments. I've observed this. Simple treatments will improve. It's just a belt. Strictly simple for stage 2, I improve with treatment. You need to correct it, but if you ask me, it's just a belt. Some people say they're doing physiotherapy, while others, if you see they are reducing weight, I'm looking to see if it actually decreases. Even with weight reduction, I'm not seeing any improvement for this. Multimodal management is important, meaning before this, whether it's a bulge, a herniation, or a prolapse, this is it. 90% of people with lower back pain have disc problems that could be present. For this particular problem, treatment absolutely certainly doesn't require surgery. You can definitely fix it with regular medical methods. What I'm saying is combine modality, then multimodality. So, what are the management techniques we'll be using? Let me explain. I'm saying that for the first 2 stages, surgery is not needed. It's a simple treatment, a medical management technique that I'm talking about. Follow it correctly, definitely for 1 or 2 months, or even up to 6 months. It can indeed definitely reduce gradually. You will absolutely definitely be completely normal. Surgery is not needed for this stage 3. What I'm saying is that the annulus fibrosus is thin, and the nucleus pulposus is that jelly-like material inside. If it bulges out just a tiny bit more, what happens is pain comes, but when that bulging touches the nerve, then the leg, it's like a current shock hitting you and you feel a jolt in your leg. This is what is important here. After that, if you look, that bulging, it becomes small pieces. It won't hit the nerve but gets stuck in a doorway. The jelly stays there. It won't hit the nerve. The jelly will get stuck and won't move. The jelly gets stuck. Physiotherapy or injections won't help. It remains. This can become severe. Work is impossible. It worsens. Are these problems of walking on a tree that is close to the ground really extreme? This can get really excessive at times. What happens is that it can go beyond limits. When the spine is fully aligned, what happens when there are issues in that L4, L5 area? That's the control for urinating and going to the toilet. It will be in the spine, and when it gets stuck in the spine, The spine can get misaligned due to pressure, and it will lose control. What happens when you lose function is that automatically urinating and going to the toilet, there won't be any control over it, so automatically urinating will happen without control. They won't be able to control going to the toilet, they'll just urinate on their own. They will just go to the toilet on their own, and this is really, we can keep it less than 1%, meaning this is for those who have less than 1%. The problem arises when they have unresolved pain beforehand. There will be pain in the back, leg feels stuck. I'm just saying this so you don't miss it. This is really rare. We see a few patients in this condition. Surgery helps them recover quickly. We see patients in this situation. Many people are like that. They come in like that, and we perform the surgery. They recover immediately, but if you look at the important aspects of the video, what I'm saying is, if you look the situation I'm talking about pain, this condition, we must not go because it is ours. How many videos do you watch? You're watching the video, and there are many doctors available next to you. If you go to an orthopedic doctor, they will immediately diagnose this. There's a disc problem, and there's a lot of pain that doesn't go away. You can't sleep at night because of the pain. It really disturbs you a lot. Disturb alarm system, our alarm that exists. We shouldn't ignore these nerve issues. We need to get it checked out. We shouldn't ignore it because it really disturbs us. We definitely need to focus on it. Go and check it out. Concentrate on that. If you take care of your health, definitely there won't be any problems. That's why this is only 1%. It's going to be very rare, like suddenly lifting a weight can cause a severe slip and immediately the nerve gets compressed. As soon as it starts, there's an urge to urinate and you can't control it. You just have to go to the toilet. The most severe problem is called cauda equina syndrome. It's really, really serious. It comes very rarely, and as soon as it happens, we need to go for immediate hospital attention. This is a surgical emergency that needs to be done immediately. If you do it within 6 hours, the recovery will be quick. If there's a delay, the recovery will take longer. This is absolutely, definitely less than 1%. It's in the 99% range. The first stage and the second stage are where 9% of the issues are. It's in the second and third stages. From the third stage to the fourth stage, transitioning, the most severe problem is cauda equina syndrome. It's definitely going to be less than 1%. Now, we have seen that if you realize there's a problem, immediately see your doctor. Reach out to your doctor. Consult an orthopedic doctor. They will conduct the correct clinical tests. Look at the hip pain. For those who have hip pain, how severe is the pain in that area? How tight are the muscles? They will check if it's a simple strain or slip, perform a neural exam. It could also be a problem, so we need to confirm that with a neural examination. When we do this, we will lift the leg straight up for the straight leg raising test. Lie down, lift leg. Easy usually. Nerve pulls with issues. Nerve pulled. Stretching impossible. Bend knee, not straight. You can stretch, but when there's a problem like this, the nerve gets pulled. Can't stretch, bend the knee, can stretch, but keep knees straight. You can't lift your leg straight up. You can't do the straight leg raise. If there's a problem where the leg is numb, is the nerve on the outer or inner side of the foot? The nerve is affected. Is it to the outer side of the foot or the inner side? Has the nerve gone to the outer side or has it gone to the inner side? If it's there, it could be L4, L5. If it's gone to the outside, then it could be L5S1. It could be that there's some weakness. There might be muscle jerks in the knee. We will check for jerks and ankle jerks as part of our neurological examination. Let's examine functions, then check with X-rays. To confirm how severe this is, we will also take an X-ray. We'll take an MRI scan. First, we do the clinical examination, then the X-ray, third MRI, all three. Let's find out which stage we are in. To find out what stage it is, we will take an X-ray. After that, we will check the X-ray. There's no significant change that we can see. The X-ray shows a slight loss of lumbar lordosis. Sometimes we say that in the X-ray, the disc doesn't show much, but bone movement and spondylosis are minimal. A lot of people are affected by this disc. This disc shows up in the X-ray. We can't really tell, but the bone movement, the spondylosis is very minimal, vulnerable, and what spondylus says. Only 5% of people will have that. Confirm with MRI for spinal cord compression. Check disc or bone issue. MRI for bone movement, spinal cord compression, spine issues. We need to check if the spine is being compressed, whether it's the bone or the disc. We need to see, check if bone or disc compresses spine. Confirm with MRI. Is the bone compressing it or is the disc compressing it? We need to find out. To confirm that, we need to take an MRI. In that MRI, we will check for the details. As I mentioned earlier, there could be a bulging disc. There might be a prolapse as well. There could be extrusion of the disc. It might also be sequestration. There are stages 1, 2, 3, and 4. This is slightly deviated in stage 1. In stage 2, if you look at it, this could also be stage 3. It could be in stage 4 as well. We will take axial cuts in the MRI. If we look at it, we can understand that this is a sagittal view of the ankle. We will take 2 more ankle images, coronal and sagittal sections. We'll take a look at this MRI and decide what stage it is. We will determine what stage it is and immediately decide on the treatment. As I previously mentioned, more than 90% of people, in fact, It will be in the first stage or the second stage. Some people have been using belts. Some people are doing physiotherapy while others are on a lot of medications. Some people are eating while others are going for natural treatments. Some people go for Ayurvedic treatments. Some will get massage treatments in this. After doing everything, if it's a 90% issue, then it's a problem for 90% of the people. This won't be satisfactory. Why? If you ask, all modalities of management need to be done. Some people need to do it. If you look at it, it's very high. They said that if I lose weight, it will be good. They are just walking, and there's nothing wrong with that. Everything is fine to do. What is accepted in the medical field is that everything needs to be combined now. There will be a lot of problems for the majority of people. Just doing simple physiotherapy, putting on a belt, and applying ice can help with the pain. We applied ice to reduce that pain significantly. Injections will fix it. Physiotherapy helps with pain. We can definitely fix that by applying it. Along with that, the pain will increase. In the meantime, we can do physiotherapy methods, pain lessons, but back pain may occur. Strengthen with cat, camel, and plank. There are strengthening exercises to reduce it. These exercises help make the back muscles strong. To strengthen muscles, we can do moves such as cat and camel and plank. We can do that and fix it. In all of this, we can also reduce body weight. By reducing it, we can go for walks and do all of this. For those who are not doing well, we tried medical methods for 3 months and saw some improvement. No, if that's the case, then there's hip pain and there's pain in the leg too. If it's there, then definitely medical treatment and surgery are needed right away. If you ask me to do it, it is absolutely not necessary. A break between surgery. Injections in the back led to my cesarean section for delivering my children. If you ask what the problem is, it's because of the injections in my back. A doctor performed a cesarean section to deliver both of my children. They gave me an injection in my back and then performed a surgery on my leg. They gave me anesthesia, and from that I started feeling hip pain. The chances of hip pain occurring due to injections in the hip are very, very low. The scientific fact is that the needle is a very thin needle. We're giving a pain relief injection in the hip, and there's a drip in hand. We're using the same amount of the gel. The thin needle is a very delicate needle. The chances of hip pain are low. Persistent hip pain can be treated with an injection. That hip pain is never-ending hip pain. If pain doesn't subside after using medical methods, we can fix that by giving a hip pain injection. Now, how do we do that? If you ask, we thought that getting an injection would cause hip pain, but that an injection is a very good treatment for reducing hip pain. We call it an epidural steroid. That's what we mean by epidural steroid. So we have many posts about steroid injections. We've used this steroid injection. The steroid is safe. It does not increase in that place, only steroid that works. What we call steroids are not harmful substances for our body. Use as recommended. All are FDA-approved treatments. Epidurals are safe. So these are all currently FDA-approved treatments. Because of this, there are treatments like the epidural that don't cause any harm to the body. Steroids are used in medical treatments for a duration of 3 months for pain. If it doesn't reduce, then the epidural steroid is the best treatment for hip pain. As long as you can tolerate it, keep it together with that. The medical treatments include drugs, therapy, and exercise. If you continue with this, it will definitely help with the hip pain. The pain will reduce depending on whether it's stage 1 or stage 2. The problem will be resolved. What that means is that the extrusion of the disc is pressing on the nerve. We're trying to improve with medical methods. It's good to see some improvement, but it's not enough. It's been 3 months and the leg pain hasn't reduced at all. The leg is getting worse and worse. We definitely and certainly talk about an endoscopic method. We talk about arthroscopy, and then we mention treatment. Through arthroscopy treatment, it's a simple surgery, a daycare procedure. Surgery today, home tomorrow, spine or back issues resolved. After the treatment, we can go home the next day. It's that simple. What treatment means when there's an issue with the spine and hands or on the back, it becomes a problem. Many patients say that they have a lot of explanations with them. They used to do that back then. During that time, they would do open surgeries and make cuts. They will need to take 6 months of rest, but right now it's like this. Arthroscopy reduces pain immediately and prevents stage 4 cauda syndrome. It's like getting an injection. An arthroscopy treatment can reduce the pain immediately. We want to avoid going from stage 3 to stage 4, which is cauda syndrome. To avoid creating a major problem, we perform arthroscopy treatment. Doing it and going home next day means facing difficulties. No choice. Why are we doing this? It's not like we're doing it for no reason. We've done a lot of treatments. There's no improvement. The leg pain is still there. Where do we go from here? There's no solution, and that's why in the medical field it's recognized. The surgery is endoscopic spine surgery, which is a minimally invasive procedure. Just like doing arthroscopy, laparoscopic procedures use a camera to precisely target that. The tissue pinches and compresses the nerve, which is the nerve pushing that nerve. Make it a one without harm and protect this unnecessary. We will focus on the bulging disc, not removing everything. The loose piece pressing on the nerve will be addressed. We won't be taking everything out. We'll remove the loose, bulging piece pressing on the nerve. What I'm saying is that the loose piece, that piece is bulging and pressing on the nerve. We are only going to remove the specific disc that is causing the problem. The remaining disc will stay as it is. Because of this, a small problem arises. If you ask, that disc might play up again or go down again. There are opportunities to bend and straighten, but it's very limited. There's a very limited chance, but it gives good results, over 95%. In that case, we can definitely follow that approach. After endoscopic spine surgery, we have microlumbar discectomy. That's thing. This is done with a small open procedure without an endoscope. We can do it by looking through a microscope. One way is to look through a camera. One method is to perform it using a microscope. These are the two approaches. Minimal invasive surgery involves a small incision. Less than 1 cm or 2.5 cm or 3 cm incisions, we can perform this. It doesn't feel like a typical operation at all. It's just a small procedure, like a little light touch. When we say door, a small opening, treatment, it's similar. The immediate result is the next day. We can start our routine activities. We can start doing household activities at home. We can start in 2 weeks, and once recovered, your daily life can continue. We can continue our daily life. We can lift weights after a couple of months. After weightlifting something hard, if there are work people, those are 1 or 2. We can do this after a few months. I've already had a disc operation. The doctor did it well. It's been good for 10 years. So now it's bothering me again. And then I told the doctor, they are looking at it for them. Whatever it is, let it be for them. The disc has indeed shifted a lot at a young age. The disc is pressing on the nerves on both sides. We can address it. We can do it using both endoscopic and microscopic methods, but even then, I shouldn't have any problems. I shouldn't have any back pain or leg pain. There shouldn't be any pain in the back or legs. Nothing should happen. For those who think like that, the best surgery is transforaminal interbody fusion, means this spine, there is a disc between the bones. This disc is good. It presses on the nerves on both sides. This disc needs to be cleaned. We have cleaned it up properly. This is a small open surgery that we are doing. As I mentioned, this is not a minor surgery, it's a major one. There's been a problem. I've already had a disc surgery done many years ago. It happened again due to an accident or something, bending down and lifting weights. Maybe because of sleeping or some kind of accident, this happened after that. The problem has increased a lot, so to prevent it from coming back, we will need to do open surgery. Even though it's open surgery, you might think it's like doing a big open surgery at that time. It's not the kind of surgery you might be thinking of. It's not a surgery that you should be afraid of. You see, we will open it up and beautifully clean that disc and take it out. We can place the disc like a cage in that space. We can put it in like a replacement cage. We will place it like that and then put in the screws for grafting. If we do the fix, we will put in the screws. There shouldn't be any problems later. Definitely, there won't be any problems with this. We'll be using titanium screws for that.
The issue that sticks to your bone won't cause any major problems. Diabetes causes issues. Treatment helps. Use proper medical methods to avoid surgery. Hip pain will improve. Foot drop will resolve. If you get the surgery done, the next day your hip pain will be much better. The foot drop will completely go away. Improvement will be noticeable the next day after surgery. It will start to gradually decrease over a month or 2, which is important. Improvement will happen after the surgery, and the foot drop will be there the next day. Did you see? Today the doctor has finished the surgeries for everyone. Do you know what I'm saying? I was scared until the surgery was done. For having surgery, then it's Dr. Nama for today. I slept without pain in my legs. I fell asleep because my nerves were pressed. This tendon issue has been bothering me, no matter how much natural therapy we do for it. Herbal decoctions help, but tendon detachment and nerve compression persist due to nerve weakness. Tendon issues persist due to weak nerves. Foot drop continues. Tendon detachment causes weakness. Foot drop, stage 1 or 2 needs treatment. You'll have a foot drop that keeps bothering you. You won't be able to sleep peacefully at night. In early stages, medical treatment is crucial. If standard methods fail, consider injections. If the methods don't work properly, we can consider injections. Even then, if it doesn't improve. If there are issues in stage 3 or stage 4, it's definitely important to start treatment early. In the condition where the tendon detachment is present, we are talking about stage 3 and stage 4. Severe pain may need endoscopic treatment. Complications may arise. If we try this for the lumbar disc, we will definitely find a solution for it. If it doesn't get better, it's been complicated for a long time. There are a lot of issues. Javu is far away in many places. There are problems. And then there is multi. The problem is indeed at a level where it's truly well compressed. The pressure is on both sides, and that's why I have back pain. Let them say that it shouldn't come later. Everything is the best transforaminal interbody fusion. That's what it is. Surgery is a superior form of treatment. This is indeed all about 100%. 90% of medical methods are minimally invasive. 5% are open surgeries. Don't worry, it's all for your benefit. In this open surgery, are we going to place screws? Are we going to do that? Don't be afraid. We will solve the problem. You will return to your old state. That's positive. Solving the problem will restore you completely. The treatment is suitable for this stage. Any setback in your life, it should not happen with such good intentions. These are the surgeries that can be performed. This treatment is the right one for this stage. The treatment will definitely be correct. That's all part of a protocol. If you follow that protocol correctly, it will definitely help. You will find relief from this, whether it's through a herniated disc or sciatica. Let it be, can I walk with a leg heavy? Let it be, I can't walk properly. Let it be, is urination difficult? Let it be, is the motion under control? Let it be, even if it's a cauda equina syndrome. If you look at this is from medical to surgical CG, a hip pain column for you, in which there is a clear understanding. Any doubt to me, please don't hesitate to get in touch.